A very good afternoon to all our viewers. On behalf of Kohinoor Hospital, I, Vidisha Pari, would like to welcome you all on Facebook Live with Dr. Chintan Patel. He is a consultant orthopedic surgeon at Kohinoor Hospital. He is an expert in joint arthroscopy, in preservation and knee replacement. And today, he is going to be speaking on the topic partial knee replacement and sports injury. Doctor, kindly give your valuable inputs on the same.
Hey Vidisha, hey everyone. So today we are going to just have this little informal kind of a conversation. We are going to just discuss a few points which probably relate to you, me, everybody in general. I have been also a very sports enthusiast. So I have had a couple of injuries on my own. So I can relate that, and we'll talk about a few of them which happen to us on a daily basis. Also probably the myths about when you talk about knee replacements, we are going to talk about a little bit about that.
Yes.
What newer things are there as of now, what we can give to our patients very practically on an everyday basis. We'll talk to that about that. Yeah. Hey,
thank you. That was by itself very informative. Well, doctor, then I'll just begin with the questions because that would be very helpful for all our viewers and us on the same. So to begin with, let me ask you, doctor, when is actually a right time to go under a knee replacement?
The time is dictated by the knee itself. So I wouldn't say it's a call by the patient or maybe not even by the doctor. The knee itself tells whether it's the right time or not. I have seen people going beyond the 90s who have got good muscular knees, no need to touch them. A little bit of osteoarthritis is common in the older age, but I don't think we need to touch every knee that has an osteoarthritis. Okay. I've seen people even at younger ages, somebody like even at 35 who have got a very bad arthritic knee. Most of them are because of rheumatoid arthritis or what we call as vaat ki taklif. So all these people probably a little younger age with rheumatoid arthritis, full blown arthritis of the knee, have to be operated even at a younger age. So we can't actually dictate an age for that. But if I were to put it into a general summarizing on basis of the statistics, I would say roughly it is around 50 and plus when we have a lot of knee replacements happening on a daily basis. So it is uncommon for patients lesser than 50 to be operated with a total knee replacement. Yeah.
So it's not even age specific, but to just generalize it, doctor, you put it like maybe above 50, but even a younger age like 35. Can be also requiring a knee replacement.
So I have had a patient who's operated at about 38 and I have had a patient who's operated at 92. So you can have those extremes in age. Yeah.
So is there any way we can do to avoid the surgery?
Very nice, because I think we need to do a lot to avoid anything that hits the knee badly in the older age. The best thing you could do is have a good muscle tone, have a good muscle power.
Okay.
Yeah. So I'll tell you what is actually the gist of having a good muscle tone for the knee.
Yes.
The quadriceps is the workhorse of the knee.
Okay.
The quadriceps is a muscle on the front of the thigh, just above the knee. If you work a good bit on your quadriceps, say just give it 10 minutes a day every day. Multiple exercises can be done for that, or even a single one is sufficient for that. Take your call on that. But if you do that, maybe you might never need a knee replacement.
So you mean to say just 10 minutes a day?
Yes.
So yes, so this can definitely help us to avoid the surgery, and it's never too late.
Very
right,
true,
doctor?
very true, never too late.
And also to put it up, because we're talking about the knee surgery, what will actually occur during the surgery and how long will the knee replacement operation take, just in case a patient is going under?
So it's come down a long way down. I mean, we have got these learning curves. When any new surgery is there, definitely the times for surgical timings are longer. So knee replacement has become a very common procedure nowadays.
Very true, doctor.
Very true. So what we have got now is we have got timings of less than an hour in most of our cases.
Okay.
So yeah, it's just an hour of surgical timing. Maybe the patient is wheeled out in another hour because of a rehab and recovery room protocols, and by the second hour the patient is ready to go to the wards.
That's so it's less than even 4 hours.
Very true, very true. Yeah.
And so it's not even so threatening as like everyone is talking about a knee replacement, a big operation.
Yes.
You put it so easy to us and our viewers. So it's just a matter of 4 hours and you are really being taken care by.
Yes.
Doctor, to talk about more about the same, what are the actual pieces that are being used in the knee replacement and how are they kept in place?
So what we try to do in a knee replacement is try and build up the natural or the normal anatomy. I am probably extrapolating a lot when I say that, because it's not practically possible to build up what God has given us, but we can match up as far as we can. So what we try and do is we give a replica of the natural cartilage. The cartilage is one of the smoothest substances given to us in the joints.
Yes.
So we try and give three components. Specifically talking of the components, there are three components in a knee replacement. One of them is the upper component, which is for the femur or the upper bone or the thigh bone. The second is the tibial base plate, which is for the lower bone or the shin bone. And the middle component is something which actually plays the role of a cushion in your knee, like a meniscus. That is the polyethylene component. So these three components make up the whole part of the knee replacement. Yeah.
It's again in a very easy way put forward. Upper, lower, and the base, everything is being taken care by. Should the patient be actually concerned about anesthesia during surgery?
Nowadays, we have got anesthesia protocols in place which preclude a lot of pain in the intra-op as well as the post-op duration. I have had patients whom on my first day rounds, I had just had the patients themselves have given their experience that the amount of pain that they had expected and the pain that they actually experienced was aeons apart. So it was something like only maybe a minuscule amount of pain that they had in mind. Yeah, something like the first day the patient gets up and walks on their own using a walker maybe, but the pain especially is less because of the block that we give. The anesthesia or the anesthetist team really works hard, and they give adductor blocks, they give femoral blocks. All these kinds of blocks with the spinal anesthesia combined gives us a very wonderful pain relief.
So you mean to say that if I have to ask you a question, that how much pain will a patient experience after surgery?
Yes.
So the answer to this is minimal?
I'll tell you in comparison. Probably comparison is the best way to put across. Suppose somebody has a ureteric stone, or suppose somebody has a renal stone, and the amount of pain the patient feels, or maybe the pain of labor in women. This is nowhere near that. It is maybe 1/10 of that, maybe like that. Yeah, because I ask my patients that, and it's their feedback that the amount of pain that they feel post-operatively or maybe in the next few days after surgery is something very less than what they've expected.
So you're putting it forward in such a easy way that it's nothing to be so scared about. You can go through it. The age is not in bar for the same. So even at a young age, if a patient is going through, so everything is taken care by. So they can definitely live a normal life post to it. So what would a patient actually expect? Even I'm very curious to know about this. Immediately post surgery.
Post surgery, the first day, we just probably because of the spinal anesthesia, we tell them to have a little break, lie around, have a little relaxed time. On the day after surgery, on the first day, we are mobilizing each and every other patient of knee replacement. So the first day the patient is walking, and not just walking nimbly, but putting the full weight on the operated side as equal as the other side, and walking maybe 100-meter walk comfortably, without pain, not with pain. That's how we're doing it.
100 meter. Have I heard it correct?
Yes, you heard it correct.
Even you heard it correct. It's 100 meters. That's exactly what a doctor is telling us.
Yes.
So they can actually walk.
Yes, they can.
So they're not being bedridden for
not
long
at all.
hours.
Not at all. So probably if I just go into that, they walk on the first day. The second day they climb stairs. So they are able to climb stairs on the second day. By the end of the first day itself, they are probably able to go to the washroom on their own without any aid or any help from any other person. The third day is an extra day. So the third day is just for the comfort. Once they are comfortable going to the washroom, once they are comfortably walking around the place, third day probably they can take a call to go home.
Third day?
Yes, very true.
So the doctor said it's less than 4 hours surgery.
It's just an hour of surgery.
It's an hour of surgery.
Yeah, it's an hour of surgery.
So within 4 hours, you are back on your bed, talking to your relatives and just discussing. And again, within 2, 3, 4th day, you are back home.
Yes,
you're
very
just getting back to your normal life.
True. Yeah.
So what do you expect then if you're getting back to normal life? So what do they expect during recovery and rehabilitation actually from knee replacement?
A big thing about rehabilitation was the concept where we needed to give a physiotherapy for an extra period of maybe 15 days or a month or 2 months. For all of our patients here, I do not suggest any physiotherapy at home. So it is just those 4 days when they are in the hospital, they are managed by a good physio team here. After that, they are knowing what exercises are to be done, and they just continue that at home. So they don't need extra physio cover. They don't need to visit a physiotherapist's place. Barring a very few who have already had some other issues with the muscle weakness and everything, almost 90% of our patients don't need physiotherapy at home. Yeah.
So you mean to say, of course, Kohinoor Hospital have all the experts out here. So the physiotherapy team, that is the whole team of yours, doctor. So they are also so expert in even teaching and explaining the patients so well that they don't need to go back home and in the word of doubt. The doctors are sure, the patient is equally sure. But still, a question arises in my mind that do they need any preparation, back home for recovery? They need to do something back home. They need to work around something.
Yeah. So we are probably cutting down a lot of efforts from the patient side. How are we doing that? The technique of surgery has been a little different in the last few years now. What we do over here is we probably try and avoid cutting right through the muscle or the quadriceps muscle. We probably do something which we call as a subvastus release. This is a technique of just probably lifting off the muscles and putting the parts in place. When you don't tease the muscles a lot, the muscles don't tease you later on. Yeah. So that's how it works then.
How about the skin marks?
We have got a lot of options. Currently we have got stitches which don't need to be removed. We can probably leave them and they melt inside. The skin injury or the skin marks that we say has come down over a period of time because of minimally invasive surgeries now. So maybe we have got a reduction by 30 to 40% in the scar length right now. So that length of the incision has gone down a lot. Yep.
So it's even cosmetically
very true.
Very good
true.
Also.
Yeah.
And so there's no special equipment or maybe a special equipment required back home, because there can be patients who are maybe not from here, Kohinoor Hospital. So would they require any special equipment back home to take care of the knee joints, or maybe the work around?
I'll just say there's one ice bag that you need, and that's the only equipment that you need. You just need to ice the knee after surgery. We just allow them to ice every 15 minutes for every 3 hours or 4 hours a day in the first few days. After maybe a couple of weeks or 3 weeks, that's the only thing you need to do in the first 2 weeks. Just ice your knee, walk around as comfortably as possible, climb stairs. Gently you can do all of your activities in the home that you used to before surgery. There is no restriction as such after surgery.
So you mean to say just an ice pack and you'll be able to get involved and engage in all the activities back to normal routine?
Yes. So I'll give you a deadline or timelines for that. First couple of weeks or maybe even first week is the time when most of our patients are comfortably walking without a walker. So the first week we probably tell them just for the confidence to come back. Once they are quite confident that they can walk around without any incidences of fall or anything, the walker is off. After a week,
you can go for a trip, you can get back to your normal routine live.
Yes.
This is the third time I'm talking about and repeating my words, normal routine live.
Yes.
So there's nothing to be scared about. Just pack your bag post the surgery, maybe after a month, and then you can just go for a trip.
About the normal routine, I'll also put it again into perspective. Many patients who probably after that 3 to 6 month period when they come to us, if that person has a replacement on one side, then second side was probably better or always been better. I ask kindly show us the side which has been operated on. They have to take a call and think about it twice before they actually know which side was operated on. So the difference in the two sides is almost gone by the third or the 6th month. 3 to 6 months is the time period when the knee is as good as the new one. So that knee is as good.
So I'll put it forward this way, doctor. Is that because it's Dr. Chintan Patel who can perform the surgery so well, or we have because there's always a question that arises in even our minds and in our viewers' minds that Is there anything differently done in the West comparatively to here, Doctor?
So when talk about the surgery, I would say it's actually a teamwork. It's a teamwork, and the surgeon's part is limited to using the best techniques available anywhere in the world. I think that is what the patients demand right now. Whatever is available as per the scientific advances has to be offered. So currently what we are offering here is one of the best things available all over the world. So we are giving them the best implants, we are using the best techniques. We don't give a lot of muscle, like I said. I don't play around a lot with muscles. We do not put in drains or post-operative surgical drains. We give them, our anesthetic team probably gives them a good amount of pain relief. So they are quite happy with that. And all of this combined with the staff and everybody gives a better experience to the patient.
Oh, so also, so it's nothing much difference that I have to fly to US or maybe not being specific with any country leaving India. It happens even in India.
I was last year in UK, and when I was there, I just had a look what exactly is the difference between the surgical experience of the patient there, or maybe what the surgeons are doing differently there. I would say there's nothing new over there. It's just that those guys are probably having been doing this. They have got the technology since a lot longer amount of time than we have had that. But that difference has played out evenly now. So now if you see the difference between the Western world and India, it's nothing. It's nothing, I would say.
So yes, of course. So you are equally good, but I would say we all are equally good.
Yes, very true, very true.
Well, the last question on the knee replacement. How long will the artificial knee joint last? And will a patient or maybe anyone require a revision? I mean to say another knee replacement in the same area?
So talking about knee replacements, the intention of a surgeon, or even when we are even just going through the surgery, the only thing that we are wanting is the knees should outlive the patient. That's the intention. And most of the knees that are designed now, especially after such a lot of R&D that they go through, they have been designed for more than 30 and more years. So right now we have got materials, something like oxidized zirconium, and I'm not going to technicalities, but all these materials or alloys that we call them, these alloys are so resistant to scratching and everything that they really sometimes outlive, or in a most of patients they outlive their lives. So most of the patients never need to undergo any other procedure. The only thing that we need to take care in a knee replacement is the softness of the bones, what we call as osteoporosis. One is that factor, the muscle tone that we talk about, and probably a few of the habits of the patients that they need to take care of. So when I talk about a revision is never at all in our minds when you're operating the knee. Even in a younger patient, we try and offer them the best of the materials, the best of the knees, so they don't need to undergo a new procedure and another procedure anytime in the future. We just tell them to be as active as possible. So after undergoing a knee replacement, rather the patient has to be more active, more lively, has to live life to the fullest. That actually helps the knee live longer.
So that's again very easily put forward. You don't need to go under a revision unless and until it's something very
you have got underlying pathologies. Maybe somebody has a terrible accident or a terrible fall, or maybe some other sort of an injury with a weak bone. If the knee just pops off, then maybe but then otherwise in other cases, most of the cases never at all.
And does the weight actually matter?
I would say the weight matters only in the range of flexion and extension that we undergo. A lot of patients with obesity have a limited range of movement of the knees, and that is not probably because of the joint which is bad. That is because of a poor muscle tone. That is because of a thicker fat pad. That's the reason. So because of these things, it's always better to work on that aspect even after surgery. We don't want them to work on that middle of the surgery or before surgery or something like that. Once they are able to walk, once they are able to undergo activities without pain, that is the best time when they can look out into the obesity aspect. So I would really say weight loss procedures can also take place after surgery.
After surgery, so that you don't need to just lose weight and come for a surgery. So irrespective of bad. So it's basically a wrong notion for us that I have to lose 20 kilos before I go for a surgery. Otherwise, I'm putting a lot of pressure on my knee joint. So it's nothing of that. It's just a myth.
So again, I'll come on to that. Probably if a patient has not had a very bad arthritis, it's only an onset of knee arthritis and we are trying to save the joint, I would say and recommend to lose weight if the patient is obese. But if the patient already has a full-blown arthritis and there is no chance where the knee can be again back to its normal phase, then there is no point in waiting for the weight loss to happen. We can undergo a surgery, and probably after surgery, when the patient is better mobilized, that time probably it will be easier for the patient also to lose weight easily.
So there's not too much to be worried about the weight loss.
Yeah.
Of course, it's basically modifying your lifestyle.
True, very
it's
true.
Important.
Very true.
But still, there's nothing to be scared about.
Yes.
So you can be within 4 hours, get back to your room post-surgery, doctor.
Yeah.
I can, or maybe my patients that we're discussing about,
Yes.
all the viewers back there can go back home within 4 hours post-surgery.
Yeah.
And within a month, they can even backpack a trip and
very
just
true,
go.
very
So
true.
it's basically
It's a lifestyle surgery. Yeah, it's actually modifying your lifestyle. It's something that changes every aspect of the life of the person who undergoes the surgery. The things they couldn't do are easier to do now.
they're easier to do.
Yeah.
So we all heard it correct. It's easier to do. You very well highlighted about the knee surgery, and that's your expertise, doctor. But we also would like to know about sports injuries. Why do we actually see these days, and even back in the past, a lot of sports injuries? We are seeing a lot of them.
Yeah.
Of course, maybe the question is like that, but I would really like to know, why are we seeing so much?
So we are passing through a phase when our nation is going a lot active in sports. A lot of children are coming up into active sports, pursuing sports very nicely. It's only a little, probably a lag when the culture changes and we are into a lot of fitness regime. A lot of the population is still out of the fitness trend. So once the fitness is at its peak, a lot of sports injuries probably might not happen. That deficit between the two is the result of the sports injury happening. So what I would really recommend, all these young persons who are interested in sports and who pursue sports, or who are like Sunday sports persons, all these persons definitely need to work a lot on getting a little bit of muscle fitness, a little bit of muscle toning done before they undergo a sports this thing. A lot of injuries are very freak injuries in their natures. So sometimes somebody never plays and just goes on a Sunday tour or a trip and throws his arm around and plays something and gets a tear, a ligament tear or a sprain. So all these things can come down with a better muscle regime. Yeah.
You just spoke about a ligament tear and a strain.
Yeah.
Doctor, I would really want to know, because even including me, we are a Sunday people, so we just go on Sunday, play sports. And yes, there are many a times that we land up into a trouble instead of too much of enjoyment that we actually planned for, but we are into a trouble and you go back to the doctor, and yes, many times they say it's just a muscle strain, but they also tell us it's a ligament tear. We are getting troubled with the same. But what is the actual difference between a muscle strain and a ligament tear, doctor?
So it's just the basic difference in what part of the anatomy is damaged. When you talk about a ligament, it is the band that connects the two bones in your knee or your shoulder, or for that matter any other joint. And a muscle is like any other muscle in the body. Active muscle sprain just is a muscle swelling. Sometimes it can land up with muscle injuries where you can have tendon injuries, where the tendon might be partially or completely torn or something like that. But most of the muscle sprains are just swellings or inflammations, which happen because the muscle has not been warmed up before you undergo any exercise or before you undergo sports activity. So I would really say the difference between the two is a ligament tear is a little worrisome thing, because a ligament tear generally takes a longer time for recover. Also, a complete ligament tear may need a intervention or an operative thing. But most of the muscle sprains happen on a regular basis to people who are not warming up before their activities. Definitely.
So warming up. So there's always said, even the coaches, they normally tell us to warm up before the exercise. So all the athletes, all the sports people, all the sports enthusiasts out there, they really need to warm themselves up with respect to any kind of physical exercise, or it is per se sports specific, doctor?
I would really say if you are into hardcore sports, it is sports specific. So if you are a badminton or squash player, you need your back of the calf, actually the soleus and the gastrocnemius muscles, to be really firm, to be really nicely warmed up before you undergo a sports activity or before you play badminton. For any other sort of a gym related activity, I would really say begin with warm-ups for at least 10 minutes before you undergo a gym session. Warm-up can be according to the body part they are exercising. So if you are working out on your biceps and triceps, a lot of guys just do that. So I would really say just stretching out the biceps and triceps one at a time helps you prevent a lot of injuries for that. Yeah.
So you really need to warm up. That's the D line.
That's
you
the
have
line.
to work on the same. So you can work on avoiding sports injuries by simple things like just warming up your body with respect to your specific, can be like a gym specific, a sports person being specific. You just spoke about stretching, doctor. So what can a sports person or enthusiast or basically an athlete work on or do something to stretch their upper body as well as their lower body? I want you to just help us with both.
There's a basic principle where every limb has a set of muscles which work in a direction, they are the agonists, and then there are muscles which work in the other direction, they are the antagonists. So when you're stretching out, make sure you don't activate the two together. So when you do that, I hope there is somebody who's in loop when you are stretching out, you know the basic stretches well. Get them to know once and then you can do them by yourself. So I would really say undergo a supervised stretching protocol first, learn them, and then do that on a regular basis every time you are going to the gym. So the stretches are very simpler. They probably are just meant to, you can say, probably take out any muscle spasms that are pre-existent. Probably just decrease the tone of the muscle initially and make it ready for the exercise that is ahead, and prevent a lot of tears or sprains that happen in the sports related events.
So it is very important to stretch your body with respect to upper body and the lower body. So even that is one of the call to prevent the sports injuries, doctor. Is there any way that we can work on treating the muscle sprain as well as the muscle strain, doctor?
As important it is to warming up, it's as important to cool down. So probably once you are through the sports activity, it's better to cool down those muscles. And if you probably have heard it or you might have seen it somewhere, a lot of sports persons undergo ice water baths or ice showers or everything. So I would really recommend, if you have worked out a muscle very badly, you have hit it really hard, ice it up, and it will really prevent a lot of inflammation setting it in the muscle. A lot of fibrosis would be prevented, and any longer lasting injuries may be halted right there and there.
So you mean to say an ice pack or just ice it up? How about massages, doctor? There's so much of massages going on. You worked out so much, now let's go for a massage. I wouldn't address like a big time athlete. I'm just talking about people who go to the gym. Doctor, how good massages are? Let me just ask you.
If the muscle has been worked out 7 days a week, supposedly somebody is like into marathons, which are quite common nowadays. A lot of lower body muscles are into that constant state of spasm, or they are contracted, and these contracted muscles are more prone to injuries. They are more prone to pain as well. A lot of discomfort is because of that constant contraction. So for all this constantly contracted phase of muscles, a massage is a good way out. So just hitting those points on the muscles can just let the muscles settle down and decontract, or probably just relax, and it will really help out prevent any further injury. So once a week, I would definitely say, who are working out 7 days a week, once a week probably is a good time to have that massage.
So you can all go to your masseur, get a nice massage done, and it is indeed relaxing also, and it's also in a way good. How is it important to take a medicine? Because there are pains, even the gym enthusiasts and the beginners, they go through a lot of pain, which is initial phase, or maybe in the basically later part. How important are the medicines, doctor, to take to heal the muscle injury?
So I would say any sort of a deficiency, if you have got an existent deficiency which is already present, the chances of an injury are more higher. So supposedly you have got a deficiency of proteins, a deficiency of vitamins, a deficiency of calcium, all these things can play up to an injury. So it's like a build up to an injury which can be prevented by taking a supplement or by taking probably a medication just to that effect. I would not recommend taking a blind strategy of taking all the pills and all vitamins on regular basis. Find out what is actually the nature of the diet that you have. Find out the existent deficiencies that probably you have. Also find out what kind of an activity you are aiming at. If your activity is probably aiming at muscle building, a lot of proteins need to be taken in. So if that is probably not there in the diet, you might need to supplement that. But not everybody needs proteins. So that myth definitely has to be broken, that you should know the intake and the output that you are undergoing on a daily basis. A very simple calculation probably. Work on that and calculate the supplements accordingly.
So you mean to say it's nice to take a professional clinical dietitian's help and work on their lifestyle modification, work on their diet, because for sports people there's a lot of carbohydrate loading which is being done, and there's a lot of myth also for protein intake, creatinine intake, but they definitely land up troubling their kidneys in the long run if it is not taken under professional advice. So it's important to see a dietitian. That I have got your point, doctor. But when is it important to see a doctor? When do we have to come to you? So
hopefully a sports person should never actually need to come to a doctor unless he's really got it really bad injury. Probably something which he cannot help himself out with is things like ligament tears in the knees. I'll just talk of meniscal tear. What is a meniscus? Meniscus is the cushion in the knee. So that meniscal tear or ligament tear are one of the most common injuries in the knees that happen to a lot of sports enthusiasts or sports persons. Sports enthusiasts are those Sunday persons, right? So I would really recommend all of them to not neglect any injury which has happened. Rather than waiting for it to settle down by simple things like painkillers, it's better to approach somebody who can help you out with that. Something like an orthopedic who can actually judge the nature of the injury, have a clinical evaluation done, maybe an imaging like an MR or an X-ray if needed, and undergo a thorough protocol. If at all, if it's a grievous injury, you need to treat it, otherwise it's going to get worse with time.
So it's only when it's too extreme we have to see you. So as it is very rightly said, even parents used to, and grandparents tells us, a best doctor is the one who gives you minimal medications. Doctor, you are the one. So you are even not asking us, because a doctor would like, no, you have to come right away to us, post the the game and all of it, but you are saying you don't need us so often. Maybe you need only at the extreme stage.
So I'll just add up a line here. Every person is their own doctor, because everybody can evaluate themselves well. It's only in denial when we have the problems. So some things like probably an injury, it's getting neglected, and probably the fear of going to a doctor is maybe making it worse. Just ignoring it, maybe trying to hide something that's always been there, like a knee pain that has existed for maybe a month or something, and you just want to try and soothe yourself that it's going to go away. Don't do that.
With also many household females.
True.
They say that we are just housewives, but they're full-time workers. They don't even have a Sunday off. So they have a lot of trouble. So they ignore just the way you have rightly put forward to us.
So a small niggle probably
right here, but in case not here, maybe through many other communication modes, doctor.
Anytime.
So I would really like to sum it up. The words are many, but I would like to sum it up in just 2 words. Thank you. Thank you so much, doctor, for this enlightening session. It was very, very informative. He's put it in a very simple way. To the relatives around, you can go back to your room, you are talking, there's not too much of pain that you need to worry about. You get back home, you don't need to come to the doctors, or the doctors coming back home to you for making you walk, or the sessions that you have to go through, the physiotherapy. The expense, doctor, is also taken care of, because you mean to say you practically in most of the cases don't need us, like, so if we don't need doctors, it's just the home care, good food, taking care of yourself. So there's a lot of expense which is being taken care by. In short, you are taken care of by. Also the young children, all the sports enthusiasts, you just need to warm up, eat right, which of course it's basically nowadays there are many people who are being careful. So just eat right, take care of yourself, and you are taken care by. It's such an informative session, Doctor.
My pleasure.
So thank you so much, and I'm sure the session is not only informative for only me, but all to our viewers.
Hopefully,
It was very, very valuable. It was so informative. Thank you so much.
Entirely my pleasure. Thank you.
Thank you, Doctor.
Thank you, Vidisha.
Thank you all.